what we also need in leadership today is some level of imagination.
Hello, everyone, and welcome to our inaugural Leadership Lessons event hosted by One Young World and the Obama Foundation. My name is Sinead Burke. I am an academic, a writer, an advocate, and a long-time One Young World counsellor. We are here today in this session to hear from an exceptional panel of One Young World ambassadors and Obama Foundation scholars and leaders on how the pandemic has affected their work, what they have done to respond to its consequences, and what kind of leadership is required in this moment to meet the challenges in front of us. The pandemic has exposed many existing social and economic inequalities. In many ways, it's magnified and amplified the divides that already existed. What do you think needs to be done to address these issues? And how can we make equity a priority?
In public health, the patient is really society. The patient is the community. The patient is the population. We try to save lives, millions at a time. We need to make sure that in our response to the pandemic, we go beyond the clinical. And that advice is coming from a physician who you expect will be prescribing a vaccine or a medicine pill. But I think the real social vaccine that we need is to make sure that our economic policies in the months and years to come will protect the world's poor from further exacerbation of poverty.
Just as what Renzo is saying is that we think we also need to be really honest about what those issues are and how they came to be. So what is that genesis of socioeconomic inequalities? What created and what are the systems that we've put in place that we reinforce as individuals to perpetuate systems that have led to the loss of lives and livelihoods globally?
So I think one of the big things that COVID-19 has done positively is that it's accelerated the need for the conversation around universal basic income, for example, state welfare, as well as a minimum wage. So I think that's something, one of the things, so I think what has to be done to tackle this inequality, I think the first thing is that we have to acknowledge that economic systems have entrenched this like very vast inequalities and big issues like COVID-19, for example, can easily exploit it. So
I think it's such a powerful message as well, that the individual choices consistently applied can actually have really great collective impact.
Are we just going to say, well, that was a horrible couple of years, but are we just going to carry on with business as normal and everything will stay as it was, and marginalized people will remain marginalized? I cannot give you an answer on how we fix inequities in society, but I do think we need to be brave, take this as an opportunity to fix our relationship with the environment, and that naturally leads to fixing inequities across the board.
What qualities and values are necessary and fundamental for great leadership in a moment like this where crisis is in the multiple?
I think this one's an easy answer. It's act like a human, not like a robot, not like someone who's obsessed with money at all costs. It's really simple. Treat people like they want to be treated. This is something we say every day.
So Brianna said, be human. I would like to add another H, humility. And COVID-19 is really a dress rehearsal for humility. When COVID-19 started, we didn't even know the genomic, a pattern or the genome of the virus, right? And then, of course, scientists look into the genetic material, and then we learn more about it. And then as we obtain more information, then we become more and more expert about the virus. And of course, there's still a lot of questions that are left unanswered.
What we also need in leadership today is some level of imagination. We need to be able to harness this imagination to do better, to figure out new systems that are novel and fair and equitable, inclusive, diverse, like, humane, like what Brianne was talking about, and just multifaceted, given the fact that the earth, like, we're so connected, like interconnected, and the scale of the crises that, we're dealing with together. I think imagination is a huge piece of this. And on top of that, just to echo what Renzo and Brianne both mentioned, I think we need compassionate thinking. We need compassionate policy. We need compassionate leaders, people who are able to feel what's happening on the ground, because as we were talking about the inequality piece earlier, there's so many parts of this that just requires a new, more empathetic, compassionate way of doing things.
We think about innovation as doing something new, but often it's also just repackaging and retooling what you already use. So we'd already started having conversations about collaborating with people, and we were able to create a new partner with someone who's already creating content to share information about what is COVID-19, what does it mean, what does physical distancing mean, why is it important to wash your hands, and making sure that there was correct COVID-19 health information going out to people en masse. One of my core values is integrity. So being able to very honestly and vulnerably bring yourself to what is happening and being honest about what's happening is so essential. But being able to course correct, I think it's been, I think the entire thing is like when people have been able to say, we've been wrong about this solution, we now need to course correct to do that. I think that's so essential in leadership. And because we're leaders, we often almost told that you can't be wrong. You can't say, you shouldn't admit when you're wrong. And what we've learned is that the leaders that have actually done a really good job have been able to say, wow, I think I don't know what I'm doing. And I need some experts, and bring that knowledge in.
I think you've brought up such a really important and integral point. From a leadership or policy perspective, so often we have looked to those individuals for all of the answers. And if anything, the pandemic has highlighted, not necessarily that those individuals are inept, but the solutions that are required need a holistic and intersectional lens. But really, I would love to get a sense from your work, and for those who are watching this session who may be familiar with the success that you've already created, but what innovative solutions are you implementing in your work to kind of adapt and to scaffold for this moment that we're in right now, and particularly for the communities that you serve?
We've kind of approached it from three areas. Number one is our team. So our team, their families, their extended group of friends were the most important thing to us. Secondly, we looked after our suppliers. So we have a lot of direct trade relationships with producers of ingredients, like in Rwanda, for example, and we wanted to reach out to them to make sure, is there anything we could do? And then retailers and businesses in New Zealand, they're sort of the other pillar, as it were. What could we do to make their lives easier? There is a statistic that 30 to 40% of retailers will be out of business within the next 12 months in New Zealand. New Zealand is a nation of small businesses. There are so many families dependent on that, and 30 to 40% is a terrifying number. So what could we do to support them? Again, initially during our lockdown period, there wasn't a great deal. We were very flexible in payment terms. We were very flexible. If people couldn't pay, so be it. We got rid of all of our minimum orders. We got rid of everything. We tried to be as supportive as possible and just try and be that flexible supplier that they needed.
What's been great is that we've had to rethink our models of distribution. So, previously for Freedom Cups, we fly the team in, we train people on the ground, we distribute the cups, and then we get them to kind of distribute it. But, now we've had to accelerate the process of getting projects as completely and wholly local as possible. We've also had to redefine the notion of need, like who is in need. Are we just looking at access to products, or are we looking at the entire supply chain?
There seems to be this idea that innovation is all about the next app, the next technology, when in fact, all we need to do is go back to our existing toolkit and see what are the things that have been working for so long that maybe we're not just maximizing and utilizing that much. And so COVID-19 is really a living case study of that. Who would even think about masking and hand washing as the really core quote unquote innovation that will protect ourselves from a virus that we cannot even see, right? So we're not even thinking of high-tech solutions. Since the COVID-19 pandemic has started, I've been very deeply involved in a lot of educational activities and research related to planetary health, not just to address the current pandemic, but to make sure this does not happen again. I think that's innovation on a planetary scale. If we actually make sure that this will be the last pandemic of this scale that will happen, not just in our lifetime, but for generations to come, I think that is definitely, a very big contribution.